in the embryology. And I'll draw the same diagram which you have done long time back. So let's see this. This is your, say, ectoderm, okay? So I'm doing like this. So you know by this that this is the neural tube and this is the neural crest, right? Now I'm going to draw the mesoderm. Obviously the mesoderm, I'll do like this. And this is the notochord. And just a quick recollection is this one is the notochord. This is the paraxial mesoderm, intermediate mesoderm, and the lateral mesoderm, which has the somatic part and the splanchnic part. Now, the final one, which you also know, that's the endoderm, is below the mesoderm. It's like this. Is that okay? Yes. Okay, this is clear to you. Now I'm going to fold it because the abdominal cavity is produced because of the folding. So what you and I look like a tube. You agree with me? The tube. If you cut it and then flat like this, no. So I'm just making the tube in front of you, and it's very easy. So what I'm trying to do is joining this with this, and joining this with this, and the other one okay, and obviously the skin has to come over here. And in order to make you understand that this is the anterior part, this is the umbilicus, to make sure that you understand my drawing. This is the posterior part, because you know that the somites, they form the vertebrae also, muscles in the back muscles and everything. But this one should be absolutely clear to you. So each one over here, in this case now it is folded, so now it looks like a tube. This is the GI tract tube, epithelium over here. Because everything is folded, so it is also folding over there. This is the endoderm. Now look, let's do one at a time over here. I'm talking to you, this is the anterior part, this is the posterior part, and the abdominal wall, anterior abdominal wall is now complete. Leaving a gap over there, this is the abdominal cavity in the matured individual. You and I have this. This is the tube we are talking about. Okay? And in the embryonic life, it is called intra-embryonic coelom. Coelom means space. You recall that we had a extra-embryonic coelom. That's for the amniotic fluid to fill it up. This is extra means outside. This is intra, or the abdominal cavity. Now anteriorly you have three layers. So over here there is a three layer over there. One is the skin, one is the muscle, one is the membrane. Now let's see how does it work over here. This is the skin, you have no problem coming from the ectoderm. Now the mesoderm is giving you two layers over there. One is the skeletal muscle over here, muscle. You know the lateral mesoderm always gives you muscles of the bone. There is no bone over here, but we had bone over here. When I asked that what are the things, any bone, any muscles of the upper lower extremity has to come from the lateral mesoderm. You know that, we talked about that. The lateral mesoderm is there. But that's for if I draw over here something like this, something like that, that will be also from the lateral mesoderm, except the skin. But over here, there are some muscles called anterior abdominal muscles. They're all coming from the lateral mesoderm. Lateral mesoderm. Okay? Now I have another one over here. This is not the muscle, but it is a membrane. And that's what I'm coming to you slowly. This is called parietal peritoneum. Parietal peritoneum. Parietal is the outside. Peritoneum is a membrane. So it's a membrane which is also coming from the lateral mesoderm. The important part over here we call is the somatic. Remember, this whole thing is the somatic mesoderm. That's what we say. Somatic, this is splanchnic. Somatic means it is supplied by the somatic nerve. That means it has a motor and the sensory. If you put your hand over here, I will feel that somebody is touching me over here. So this is a sensory sensation. You understand? Because supplied by the somatic nerve. Somatic nerves are just like a radial nerve, ulnar nerve, musculoskeletal. These are all somatic nerve. It's supplying to the muscle and they give some sensation, a cutaneous branch or whatever it may be. Is that okay? So, one more time, you have basically 3 layers. Okay? The detailing you learn that some fascia is covering that, but it is all, everything is somatic. So, skin, then the skeletal muscle, followed by the membrane over here. If you go to the back side, you have also 3 layers. The one layer is coming from the endoderm. And then after that, there is one layer coming from this splanchnic mesoderm. It is producing smooth muscle. Not the skeletal muscle, smooth muscle. And then you have another membrane. It's very similar over here. This membrane is called the visceral peritoneum. So I use the word peritoneum on 2 occasions. One parietal peritoneum, one is the visceral, because it is covering a viscera. This looks like a GI tract, will be over there. So if I draw a GI tract, say for example stomach, for example, okay? Let me draw the stomach. Stomach over here. And then the stomach has some smooth muscle, isn't it? Stomach has smooth muscle. And then it is covered by a membrane, which is the serous membrane, okay, which is called the visceral peritoneum. This structure and this structure is the same. Let me tell you the orientation of this structure. This is the baby, the head is over here, the leg is over here. I can see the leg over here. Or if I stand in front of you, my head is over here. If you pull my leg, then I'm over here. And you are making a section, which is a coronal section, right over here. You know, it's over here. So think about it. This is when I do this, this is more ventral or anteriorly placed. My umbilicus over here, and just visualize this. So this is a hand over here on the stomach. I will not get any sensation. If I put my hand on the heart, I will not get any sensation. But these are all supplied by the autonomic nervous system. You are not believing me. So think about it, that you just came to me after eating cereal and milk in the breakfast. And you are not stopping me and say, Dr. Paul, stop a little bit, because I see my cereal is moving from the stomach to the duodenum. Oh, it has gone to the intestine. So I'm getting some sensation. Are you getting it? No. Why you are not getting it? Because it is supplied by the autonomic nervous system. On the other hand, if you put a bunch of cereal over here, cereal, get rid of the cereal over here, because this is a somatic nerve. And the God has given us that beautiful structures because of this, because you don't feel the heart is beating. Unless all these things are pathological. You do get pain if the stomach has a problem bleeding, because that is a different scenario. Some chemicals and other things come. But normally you don't get any kind of sensation because of the autonomic nerve. Yes?
The visceral peritoneum and the smooth muscles of the stomach are from the
Visceral peritoneum.
splanchnic lateral mesoderm.
What did it say?
He's talking about the smooth muscles and the visceral peritoneum. He's
Yeah.
saying where do they come from?
I told you that smooth muscle is this one, is coming from the splanchnic mesoderm. The word splanchnic meaning viscera, like stomach, the kidney, the pancreas, or these are all called viscera. And the splanchnic is always supplied by the autonomic nerve. So anything you see over here all belong to autonomic nervous system.
And the best
Yeah.
also from that.
Visceral is also from the autonomic nervous system. This whole place is autonomic nervous system. Is clear? So now I'm talking about this one and this one. It belongs to peritoneum. One is called the parietal peritoneum. One is the visceral peritoneum. Is clear now? Second concept. Now I'm going to take these two out. Only the peritoneum. So it is looking like this. And I put some air inside or gas inside. See how does it look like then? So it will look like a balloon. This space, if I put some gas, it is a balloon. Now the important part over here, that all the organs, GI organ, this is the lateral view. I'm trying to do that so that if people wouldn't, this is the umbilicus. Okay, so you can understand the lateral view. This is posteriorly, this is anteriorly. Okay, lateral view is a balloon. What is that balloon? This one, between this and this. So this is the parietal peritoneum, this is the visceral peritoneum. Is that okay? Now all the organs which are produced, just name some of the organs like liver, the stomach, transverse colon, intestine, or maybe the pancreas, duodenum, kidney. All these structures are coming from behind. So let's draw that. So what I'm saying is over here simple. Say this is the liver, I put L, then this is the stomach, then is the transverse colon, and this is the intestine. Over here I put it the pancreas, and then duodenum, and the kidney. So I put all the organs, common organs that are placed over here. They are all coming from the behind. And I request all the students not to memorize. You can see that this is $1 million picture. You see that all the organs coming from behind. This is your visceral peritoneum. This is your visceral peritoneum. All the organs are formed from behind. Now, some of the organs are very active. They come exactly at 8 o'clock. And some of the organs are sleeping. They don't come at 8 o'clock. They take it easy. So, some of the organs means like liver, stomach, transverse colon, and intestine, they actually move. Move where? They move towards the balloon without puncturing it. So how does it happen? If I move towards the balloon, say this is the membrane, and it can go inside without puncturing it. There is no hole over here. So if I take it out, then there are two layers of the peritoneum, visceral peritoneum. We call mesentery. This one. The organ can be taken out. Mesentery. So if I draw that, a nice diagram, I want to make it in front of you. So what I'm trying to do, and I'm writing inside liver, stomach, transverse colon, and intestine. And the pancreas, duodenum, and kidney remains outside. Makes sense to you? They are these organs are intraperitoneal. When they move inside, you are inside. You are very active. Came at 8 o'clock. Came inside the house. Inside the balloon. If I take it out and put some gas again, it will be like this. The diagram shows like this. Right? Make sense? So these organs like liver, stomach, transverse colon, and intestine are intraperitoneal structures. On the other hand, the structures like pancreas, like most of the part of the duodenum, as well the kidney, they do not move. So they stay there. And therefore, they do not have a mesentery. The mesentery we talk about in the two layer of peritoneum belong to some of the organs which are intraperitoneal. And mesentery in the different places, they are named differently. That's not difficult for you to understand. For example, sometimes the mesentery we call lesser omentum or greater omentum or transverse mesocolon or the mesentery. These are the different names, but it's a mesentery. Mostly it is the two layer of peritoneum because they are intraperitoneal structure. So inside the balloon, it is little bit, some of the organs go inside. Now between you and I, okay, we should look alike inside the abdomen. Okay, let's see the adult life. How does this thing look like? So I'm drawing the final picture in terms of how do we look like in the adult. In other words, if you open the abdomen, how does the abdomen look like? It should look like this way. So let's draw again. Let's draw over here maybe. I can make it. Okay. I take this out, okay? So it will be easier. So I put liver over here. This is a very nice diagram that you have to. This is the liver, stomach. I put the transverse colon, liver, stomach, transverse colon. And I'm putting the intestine many times because intestine is too big. Okay, over here. And then look at my diagram. I'm just covering it with the peritoneum. So liver, most of the liver is covered with the peritoneum. Then it comes to the stomach to form a two layer of the peritoneum, which is called lesser omentum. Omentum, the word comes from the stomach. It's probably the Latin word. People use it, Latin or Greek word. My feeling is that it is a Latin word probably. Then it comes like this way, it hanging, and it goes back again, forming four layer. Instead of two layer, it's four layer it is forming. And then covering the transverse colon and form the transverse mesocolon. Covering the intestine, and then this part is the lateral view again, and this one is joined over here. I'll draw it, don't worry, I'll repeat it.
Is this like all of
This is how we look like. I'm coming to that, step by step. So from the liver to the stomach, we call, it's a mesentery. This should have a mesentery, this should have a mesentery, because they are intraperitoneal. And this is called lesser omentum. Omentum means anything attached to the stomach. If there is a lesser omentum, there should be a greater omentum. So this is called the greater omentum. So when we open the abdomen, you see the greater omentum is hanging over there. Greater omentum. It is the peritoneum, peritoneal fold, visceral peritoneum, but it's basically four layer. Instead of two layer, you can see two layer coming and then goes back again. Now it hits the transverse colon. Now you should say with me a couple of words, okay? Speak. Say transverse colon is present below the stomach. Again, transverse colon is present below the stomach. So this is the stomach, this is the transverse. It's very important because another lecture, another research session, I'll explain to that, and this will open up your mind that oh my God. So embryology is the fundamental knowledge, in the understanding of the GI system. Yes.
Doesn't the liver cover all of that?
No, only let's see I'm smart enough. I left a little bit.
Okay.
It's called bare area, yeah. So mostly, but let's think about mostly it is covered. I'll repeat it okay, before you comment. So when it is covered in the transverse colon, then it forms a little, again a peritoneum called transverse mesocolon. Because it should have a mesentery. This is a mesentery, two layer, but it's called the transverse mesocolon. Then it comes back over here, and then it forms, cover the intestine. So these are all intestine. And I make many times because intestine is everywhere in the abdomen. And then finally over here. When it is covering the intestine, the mesentery over here is called the mesentery. So the mesentery over here is called the lesser omentum, mesentery over here the greater omentum, mesentery over here is called the transverse mesocolon, which is attached to the transverse colon, and over here is called the mesentery, because that is very important. You try to understand why it's called the mesentery, because it is very big, like a fan-shaped peritoneum. When you are running, the intestine is not going like this way. This is anchoring mechanism, so it is not allowing it to move too much. That's why it is all attached. We need the peritoneum to be attached. Otherwise, you are running, intestine will hit over here, you get a sensation then. We don't want that. This part is sensitive. So that's the reason. So this is the organization of this. So when you open the abdomen, you will see like this. This is the structure. So you will see somebody say, where is the transverse colon? You know, Dr. Paul said 10 times. You need to. That transverse colon should be below the stomach. So when you do the dissection, that is the key to understand why I tell you that. This is the fundamental thing. And by doing this thing, now you can see the whole abdominal cavity, this one, is divided into two parts. One is the white part, we call greater sac. Greater sac. Sac means space. If there is a greater, there should be a lesser sac. So this is the lesser sac, or often called omental bursa. Omentum is stomach. Behind the stomach, there is a space called omental bursa. Try to understand why I'm saying this. So it's very clear. So you have a balloon. Inside the balloon, it should be very smooth, but it is not. In the abdominal cavity, is not smooth that way. Posteriorly of the abdominal cavity, it is like this. That is the way. It is like this, because the organs have gone inside. Organs from posteriorly, it has gone inside, and take the peritoneum like this way, and making the two space, greater sac and lesser sac. Why it is important? I just give one example that will open up your, understanding. If there is say somebody has a traffic accident, there will be bleeding. So what a surgeon will do, he will open the abdomen and see where the bleeding is coming from. He will clamp some of the arteries over there. Bleeding is stopped. Now the bleeding is already there in the greater sac. You have to clean it. So when you clean it up and then stitch the anterior abdominal wall and send the patient back home. The patient will come back because you did not clean properly, because some of the hemorrhagic fluid is already inside of the lesser sac. You did not clean. The surgeon have difficulty going to the lesser sac because there is a connection over here. Why? Because there is a epiploic foramen or omental foramen which connects the lesser sac or the omental bursa of the greater sac. So the fluid over here, it will bound to go over there. Bound to go over there. So how to clean it? So surgeons, they are very smart. So they cut the transverse mesocolon. Now look at what happened. All the fluid trickle down over here, and then you can clean it. The transverse mesocolon is the way to do this thing. You understand this? So what did I say so far to you? I said that the fundamental understanding of the peritoneum comes from this one. So you take this visceral parietal, you put it over as a balloon, then you see the from posteriorist organs are coming, then how far there are, some of them are retroperitoneal, some of them are intraperitoneal, and then finally how it is organized over here. You don't need more than this, less than that. Thank you very much. I think
Please come.